I think this is really a defining moment for healthcare in the state of Oregon, and I think if we are successful, probably for healthcare beyond our borders. It gives us an opportunity to fundamentally change our delivery model from one that focuses on after-the-fact acute care to prevention and wellness and the community-based management of chronic conditions. We have committed to reduce the Medicaid cost trend by 2 percentage points by the end of the second year, which will save, both in terms of state and federal dollars, about $11 billion at the end of the decade. We estimated that if every state Medicaid program in the country were to adopt this model, the net savings would be about $1.5 trillion over 10 years. To put that into perspective, the Super Committee is planning to find $1.2 trillion over the same period of time by decimating non-security domestic discretionary spending. We would be doing this by creating resources that could be put back in other parts of the budget, but more importantly, making Americans and making Oregonians healthier. So this is the first piece of really good news this week, that we have been given the latitude to go forward. And I threw this little chart up here, which you have seen many times before. But if this is sort of economic burden and this is time, and we want to move from our current system to a new system, and it didn't really cost anybody anything, it would be pretty easy to do, and we would have done it a long time ago. The problem is that these providers who have stepped up to the plate here have agreed to continue to provide Medicaid services under the existing system while making the investment in medical homes and HIT and the other capacity that's required to move to a new system. And that was the argument that I think convinced our federal partners that this was a wise investment, that you can't get from here to there without making an initial investment in capacity, because we have an obligation to continue to serve our existing Medicaid clients even while we produce a better system for them for the future. So that's the first piece of good news. The second piece of good news is that it appears as though we are going to have enough organizations lined up to actually take advantage of this significant federal investment. So we had a very important milestone this week, even before our team went back to Washington, D.C. On April 30th was the deadline for those organizations that wanted to become coordinated care organizations to put in their applications. And the results far exceeded our expectations. We have 14 organizations that applied, and if all are approved, it will cover over 90% of our Medicaid population. And we knew that there were some really remarkable conversations going on in this city and in every corner of our state, but we weren't really sure if at the end of the day people were willing to stand up, to work together under a single budget, to commit to collaboration and to commit to reduce costs and improve health outcomes. But that, in fact, did happen. So those two milestones this week are put us in a position to actually move this forward. I think it's worthwhile to reflect on how we got here. Fast forward backwards to January of 2011, when we were faced with a $3.5 billion budget deficit. What happened in this state was truly miraculous. This amazing coming together of Democrats and Republicans, people from urban and rural parts of the state, consumers and providers, business and labor, who were able to position us to do this because they shared a common vision of the future, and I think understood the common challenges that were required to reach that future. So literally, in the words of George Bernard Shaw, in this state, we not only saw things as they were and asked why, we dreamed things that never were and asked why not. And we are now posed, I think, to deliver on that dream. And it's important to recognize that this goes far beyond health care. This has everything to do with public education. It has everything to do with the business climate in our state. We've set some hugely ambitious goals, our 40-40-20 goals, which will not be achieved unless we can refuse millions, billions of dollars back into our system of public education and early childhood investments. This step, by bending down the cost curve in health care, gives us one source of resources that can be redirected to early childhood into our system of public education. It also has everything to do with our businesses. If you recall, when we reformed our workers' compensation system back in the day, we saved Oregon businesses probably $14 billion in the decades that followed. If we can bend down the cost curve in the Medicaid program by 2 percentage points a year, imagine the competitive advantage Oregon businesses would have if we were to bend down the cost curve of general medical inflation by 2 percentage points a year. That is the long-term objective here, to achieve that. And then we've got the leadership of the Oregon business community. We've got the president of the AFL-CIO. I think I saw Alan Yorty from Peace Health out of Washington, and oh yeah, there's Al back there. I mean, legislators of both parties, you know, we've got a divisive recall election going on in Wisconsin. We've got a divisive national presidential election, and here we are, all together doing something that I think is profoundly important. And the real winners here are the people of the state. First, the 600,000 people on our Medicaid program who aren't facing the decimation of that program, who are in line for better care at a lower cost. But beyond that, it gives hope to the hundreds of thousands of Oregonians today who are having to choose between a hospitalization and a college education, or their rent and a visit to the ER. Those are the real winners. This is not the ending. This is clearly the beginning. We have to actually demonstrate that we now can bend that cost curve down. The only thing that stands between this state and success is ourselves. We've got no one else to blame now. We've got the latitude from the federal government. We've got the resources from the federal government. We've come together this far, and we are not going to let Oregonians down.